Rocky Mountain Spotted Fever. What is it? Rocky Mountain Spotted Fever is an infectious disease that is spread by ticks. This disease can potentially be fatal if left untreated. It's a relatively rare disease with a few thousand cases reported to the CDC each year. People who live in or near wooded or grassy areas or who are frequently in contact with dogs are more at risk for this disease. Some facts. Rocky Mountain Spotted Fever is the second most reported tick-borne disease and is right after Lyme disease. It most commonly affects people ages 15 and younger, and most cases occur in spring and summer just because that's when more ticks are out. The infectious agent involved is Rickettsia rickettsii. R. rickettsii is a gram-negative intracellular Coccobacillus bacterium. Transmission. Rocky Mountain Spotted Fever is spread by the bite of an infected tick, and so it's primarily American dog ticks, which are found in the eastern, central, and western U.S., Rocky Mountain wood ticks, which are found mostly in the Rocky Mountain states, and brown dog ticks, which are found in the southwestern United States and along the United States-Mexico border. R. rickettsii is then transmitted to the bloodstream by the tick salivatory secretions. It can be contracted through an infected host feces, but this is really rare. The infected host feces can get into an open wound of an uninfected host, or the uninfected host can get infected by eating food that is contaminated with the feces of the infected host. It cannot be transmitted from person to person. So these are the ticks that carry this disease: the American dog tick, the Rocky Mountain wood tick, and the brown dog tick. Where is it found? Rocky Mountain Spotted Fever was first identified in the Rocky Mountains, which is why it got its name as Rocky Mountain Spotted Fever. However, it's mainly found in the southeastern United States, so states like North Carolina, Oklahoma, Arkansas, Tennessee, and Missouri. Those account for over 60% of its cases. It can also be found in parts of Canada, Mexico, Central America, and South America. So this is a map of the United States with all the cases on it. You can see it's mostly in the states that I listed, like Arkansas, Tennessee, North Carolina, Oklahoma, but it's still spread out really across the United States, a few cases. Epidemiology. The number of cases of Rocky Mountain Spotted Fever has increased over time, with a peak of 6,248 cases in 2017. However, it's difficult to distinguish if all of these cases are actually Rocky Mountain Spotted Fever, or if some are just less severe spotted fevers. Although the number of cases has risen, the fatality rate has decreased since the 1940s, and this is because the wide availability of antibiotics to treat it. And this is a chart that shows the number of cases per year. You can see it in the early 2000s, it was relatively low, and then it kept getting higher and higher until 2017 when it peaked, and it went back down in 2018. The signs and symptoms. The early signs are high fever, severe headache, malaise, or feeling of discomfort, illness, uneasiness, myalgia, which is muscle pain, swelling around the eyes and on the back of the hands, red eyes, and gastrointestinal systems like nausea, vomiting. And then the late symptoms are diarrhea, abdominal and joint pain, altered mental status, cerebral edema, which is swelling of the brain, respiratory compromise, necrosis, which requires amputation, and that's when like the cells in the arm or leg or hand die and you have to amputate. Multi-organ system damage, like damage to the central nervous system or renal failure, and pinpoint reddish lesions. So the rash that's associated with this illness is the Rocky Mountain Spotted Fever rash. It occurs in about 90% of patients. It develops within 2 to 5 days after the infection occurs. It appears as small, flat, pink macules on the body, and it usually appears on the wrists, forearms, ankles, and feet till it moves inwards towards the trunk of the body. The rash will turn a darker red or purple color and have more spotted appearance as the disease runs its course. So these are some pictures of the rash. You can tell it looks a little like spotty, and that's why it's called spotted fever. And it starts on the hands and the feet and then moves on to the back and the front. Long-term effects: if it's not treated right away, it can cause damage to internal organs and tissues. So it can cause inflammation of the brain, which leads to seizures and comas, inflammation of the heart, inflammation of the lungs, kidney failure, gangrene in fingers and toes, which is where the cells die, turn black, enlargement of the liver or spleen, and even death if you go untreated. In more severe cases, the long-term effects can also be more severe. So you can have neurological deficits, partial or complete hearing loss, weakened muscles, partial paralysis on one side of the body. How is it diagnosed? Rocky Mountain spotted fever can be difficult to diagnose because the early signs and symptoms are very similar to those of other diseases and illnesses like the common flu. So when you go to the doctor, they're going to consider your history, like your travel history, if you've had a recent tick bite, exposure to areas where ticks are commonly found, and to areas where Rocky Mountain spotted fever is endemic. And then laboratory tests can check blood samples or rash specimen for the bacteria. And the lab tests can also be ran on the tick if it's still present. And the indirect immunofluorescent antibody assay for IgG is used and they use the R rickettsii antigen to test for that. And if treatment is not delayed, they don't wait for the lab test to come back before they do treatment because it can worsen. So they just go ahead and start treating if they just suspect it to be Rocky Mountain spotted fever. So the treatment is doxycycline, which is an antibiotic, and a delay in treatment can result in severe illness or death. Prevention: there's no vaccine for Rocky Mountain spotted fever, so there's some things you can do, like know where and when to expect ticks. So wooded or grassy areas. Most people have them in their backyard. I know I do. And you may come in contact when hunting, camping, hiking, gardening, or any other outdoor activities. So some things you can do are treat clothing with products that contain permethrin. You can wear long pants and sleeves, which is kind of hard to do in the summer, but you can use insect repellent. You can shower immediately when inside. You can check yourself and your pets for ticks. And you can use tick control products on pets, like tick pills and stuff like that, to avoid them getting on your pets. Thank you.